Mrcs History Station, Pulmonary Embolism. The patient will present with chest pain. Good morning, I'm Dr. Ali, one of the surgical doctors working here. May I confirm your name and age, please? Good morning, doctor. My name is John. I'm 47 years old. Nice to meet you, Mr. John. How can I help you today? I've been having some chest pain that's been getting worse over the past 3 hours. It's been bothering me a lot, doctor. I'm really sorry to hear that, Mr. John. Where exactly do you feel the pain? It's here in the middle of my chest, doctor. When did the pain first start? I told you, doctor, 3 hours ago. Okay. How has the pain changed or developed since it began? It's getting worse, doctor. How long does the pain typically last when it occurs? It's constant, doctor. It's constant all the time. Okay. How would you describe the type of the pain, Mr. John? Is it sharp, dull, or stabbing? Stabbing, I would say. Does the pain spread to any other area, Mr. John? No. Is there any specific time of the day or activity that triggered the pain? It started just 3 hours ago, doctor. I don't know that. Okay. On a scale of 1 to 10, with 10 being the worst pain imaginable, how intense is the pain? I would say 8. That must be difficult. Yes. Don't worry, we will help you. Does anything make the pain worse or better? No, it's constant. Nothing makes it better or worse. Have you noticed any other symptom or factor associated with this chest pain? Yes, I have shortness of breath. Does the breathlessness come and go, or is it constant? It comes and go, but in the last hour it's been more frequent. Okay. Now let's discuss some associated factors that can help us narrow down the possible causes. Okay, Mr. John? Yeah, doctor, please. Have you noticed any coughing, bringing anything up, or any blood when coughing? Yeah, I cough often in the last 3 hours, and there is a taste of blood in my mouth. Okay. How about breathlessness? Have you been experiencing breathlessness? Yes, doctor. That's what I told you. You just asked me about this. I apologize for asking the same question. Let's move on. Have you had any recent surgeries? Yes, I had a gallbladder removal 1 week ago. Have you experienced painful legs? Yes, I'm glad you mentioned that. Have you been ill or have a fever? Yes, I have been feeling unwell, but there is no fever. Do you get a wheezy chest? No, I haven't experienced any wheezing. How has your appetite been? My appetite has been normal, no change. Have you noticed any unintentional weight loss? Do you ever get breathless when lying flat? No, I don't get breathless when lying flat. Do you ever wake up gasping for breath, Mr. John? No. Have you been experiencing muscle or joint pain? No, I have not. Okay, now let's talk about your medical history. Do you have any other medical condition, or do you see your GP for anything? No, I don't have any other medical conditions. Do you have a history of surgeries? Just the gallbladder removal that I told you about. Okay. Now let's talk about your occupation and home life. Do you have a difficulty with the stairs at home, Mr. John? Yes, climbing the stairs has been challenging lately. Do you smoke or drink alcohol? I used to smoke 1 pack a day, but I quit few years ago. I don't drink alcohol, no. Okay. Congratulations. I'm glad to hear that you quit smoking. Have any of your family members had similar health issues? Not that I'm aware of. Now I would like to hear your thought, Mr. John. What do you think might be causing your symptoms? And do you have any concern about your health? I'm not sure, but I'm worried it might be something serious. I just want to figure out what's going on and get better, doctor. I understand your concern, and we will do our best to investigate. Is there anything specific you are hoping we can do for you in this process, Mr. John? I just want to find out the cause of these symptoms and receive the appropriate treatment, doctor. Thank you for sharing your ideas and concerns. We will consider them while conducting further tests. Rest assured, our main goal is to provide you with the best possible care and find answers to your health issues. Do you have any nausea, vomiting, or abdominal discomfort, Mr. John? No, none of these symptoms. Do you have any urinary issues? No. Any joint swelling or stiffness? No. Any change in sensation, numbness, or coordination? No, I think my neurological function seems fine. Thank you, Mr. John, for sharing this. I will discuss this finding with my senior and get back to you. Thank you, doctor. And as you know, then you will have the discussion with the consultant. The discussion will continue for 3 minutes. The first question usually will be present your patient. So it's very important to practice presenting your case, because this will give the consultant the first impression about your performance. Present your patient. During the history taking, I interviewed John, a 47-year-old male with chest pain for the past 3 hours, described as stabbing and rated 9 out of 10 in severity. He also experienced shortness of breath and cough with taste of blood. The patient had a recent cholecystectomy, no history of MI, and no other significant medical condition. He quit smoking a few years ago by living in a house with a difficulty climbing stairs. Systemic review revealed no respiratory, gastrointestinal, genitourinary, or neurological or dermatological symptoms, and no unintentional weight loss or change in appetite. Okay, doctor, what are your differential diagnoses? My top differential is pulmonary embolism, because he had the surgery and his typical presentation. Then I need to consider acute coronary syndrome, musculoskeletal pain, gastrointestinal issues like gastritis and peptic ulcer, anxiety or panic attack. Okay, how will you investigate your patient? I will start by imaging. The most important investigation is CT, pulmonary angiogram, to visualize pulmonary arteries and detect blood clots. I may use ultrasonography of the leg to check for deep vein thrombosis, which is a common cause of pulmonary embolism. Blood tests. I may do blood tests which include D-dimer tests to assess for the presence of blood clot breakdown product in the blood. I will also perform complete blood count to check for abnormalities such as anemia and assess platelet level. I may do blood chemistry to evaluate kidney function and electrolyte levels. Another important investigation is electrocardiography, to look for a specific change in the heart electrical activity that may indicate strain or damage due to pulmonary embolism, and also to check for cardiac causes. How will you treat your patient? Okay, firstly, anticoagulant therapy. I will initial administration of heparin, intravenous bolus of 8 units per kilogram, followed by continuous infusion of 18 units per kilogram per hour. One of the choices of the anticoagulant is low molecular weight heparin, enoxaparin, 1 mg per kilogram subcutaneously every 12 hours, or dalteparin, 200 units per kilogram subcutaneously once daily. Then transition to oral anticoagulant, warfarin, with a loading dose of 10 mg, followed by adjusted maintenance dosing to maintain the target INR between 2 to 3. Or direct oral anticoagulant at a recommended doses, apixaban 10 mg twice daily for 7 days, followed by 5 mg twice daily. Okay, then I'm gonna give oxygen therapy. I will provide to maintain oxygen saturation above 92%. And thrombolytic therapy, alteplase, tissue plasminogen activator, 10 milligram administered over 2 hours by intravenous infusion. And the last choice is inferior vena cava filter placement, guided by specific patient characteristic and the choice of filter type. Thank you, doctor.